You have 1 minute to review the quiz. Good morning. Please come in and have a seat and tell me about your problem today.
Good morning, doctor. Well, I've been feeling really run down for this past week. I thought it was just a cold, but I'm just not getting better.
I see. Can you describe your symptoms in more detail?
Sure, it started with just a sore throat and mild cough, but now I feel completely exhausted, like muscle aches. I've lost my appetite, and I'm getting chills on and off throughout the day.
Okay, that's a little concerning. Have you been monitoring, you've been checking your temperature?
Yes, I measured it last night and it was 38.7 degrees. I've been feeling feverish in the evenings for about 3 days now.
Any other flu-like symptoms like a runny nose, congestion, or even headaches?
Not really, just the cough, the fever, and the fatigue. But I have noticed some shortness of breath when walking up the stairs.
Okay. That, combined with the fever, could indicate a respiratory infection. Tell me about your cough. Did it start dry or productive?
It was dry for the first few days, but now I'm coughing up this thick mucus. It's yellowish green in color.
Okay. That suggests you might have a bacterial infection. Have you had any chest tightness or pain?
Not exactly pain, but I do feel pressure in my chest, especially when I take deep breaths.
Okay. Has anything like this happened before? Or do you have any history of pneumonia, bronchitis, or even asthma?
Oh, no, never. I usually get a cold once or twice a year and then recover quite quickly. This feels kind of different.
Okay. What about, have you been around anybody that was sick recently?
My husband had a bad cough last week, but he's doing better now.
Okay. And what about any underlying medical conditions like diabetes, hypertension, or autoimmune disorders?
No, I've always been very healthy.
Okay. Do you have any history of allergic reactions or seasonal allergies?
Nope, nothing like that.
Okay. What medications or supplements are you taking now?
I just take a daily vitamin supplement, nothing else.
Okay. And do you smoke or do you have a history of smoking?
Oh no, I've never smoked.
Ah, good. Good to hear. I'm going to check your vitals now. Let's start by listening to your lungs. Could you take a deep breath in for me and out? Okay, one more time and out. Okay, I don't think I need a third. I think I heard everything I need. Okay, I can hear some cackles in your lower lungs, which might suggest an infection. Your oxygen saturation is lower than normal as usual. I want to send you for a chest x-ray to rule out pneumonia.
Oh, pneumonia? That sounds serious.
It can be, but if we catch it early, antibiotics should help you recover quickly. Since you mentioned shortness of breath and a persistent fever, I want to be cautious. If we can confirm pneumonia, we'll start you on a targeted antibiotic course.
All right. And should I rest at home?
Oh, of course. Avoid any exertion, stay well hydrated, and get plenty of rest. You can take paracetamol to help with the fever and muscle aches. If your symptoms worsen, especially if you struggle to breathe or your fever goes above 39 degrees, come back immediately or go to the emergency room.
Okay. And what about my cough? It's really keeping me up at night.
Okay, I'll give you a cough suppressant for nighttime to help you sleep. During the day, it's better to allow your body to clear the mucus, so I wouldn't suppress it entirely. Also, try drinking warm fluids and using a humidifier if possible.
Okay, that makes sense. And how long do you think the recovery will take me?
If it's mild, you should start feeling better this week, but it could take up to 3 weeks for your energy levels to fully return. If there's no improvement in 48 hours, we will need to reassess.
Okay. I'll follow your advice and monitor my symptoms then.
Good. I'll arrange the x ray now and we'll follow up once we have the results.
Thank you, doctor.
You now have 1 minute to complete your answers.